and your own. Satisfaction guaranteed. Less stress, more love, comfort zone. I am here with Dr. Peter Denooij, basically from Holland originally, but now living in the Dominican Republic. But his business, which is why we're here talking today, is based out of Canada, Edmonton, Alberta, Canada. And it is based, I'm sure there's other things you do, Dr. Denooij, but the thing that interests me is this non-surgical castration of dogs, neutering them with just an injection into their testicles. And this is something you're doing around the world. So welcome to the show, and congratulations on doing something so badly needed by so many countries and so many dogs, and such a great solution that cannot really be achieved any other way. Tell me, how did you, as a veterinarian who's been involved all your life in various aspects of veterinary medicine, how did you become this person who's a voice for non-surgical castration of stray dogs?
4 years ago, I was exposed to specifically non-surgical castration with calcium chloride. At the time, I was a member of the board of directors of the Alberta SPCA, and we had a health conference, animal welfare conference, and at this conference, Ruth Steinberger of Spay First, based out of Oklahoma, about the state of Oklahoma in the United States, presented this paper on use of calcium chloride in dogs and cats for non-surgical sterilization. This triggered my interest, and we started talking, and subsequently we started working together, looking at how we could come up with solutions to get this implemented around the world, and hence I started this company together with a partner to try and provide calcium chloride to veterinarians around the world in a handy, easy, proper concentration, presentation at a very reasonable cost. That's basically what it's about.
It's a wonderful idea. I think that over the years on this show, and anyone who's interested in the health and welfare of dogs and cats worldwide knows that spay-neuter is the only way to control population growth and the misery of those dogs and cats that live in the streets. Whether they live or die there, it's a miserable life. And there's no way to equip and train enough vets, if there even were enough vets around the world, to do surgical castration on male dogs. It's fairly simple for that vet who has a clinic and they're all set up and they have nurses and anesthesiologists and everything's sterile, but not so easy in the streets of the Dominican Republic where you live, or India or Haiti or anywhere in South America, all the places where street dogs and cats proliferate. Is there some hope that the worldwide veterinary animal health community, whatever that means exactly, World Health Organization for Animals, would embrace this more heartily and aggressively than trying to ever so often, train 6 vets in a northern part of India to do 11 spays a day, or neuters, I should say. This is just for neutering. How do we get them to shift to this much more economic and feasible way of stopping reproduction?
That's a very good question that we've been trying to find answers to for the last, I've been only involved with it for 4 years, but even longer than that. The use of, for instance, calcium chloride was introduced back in the late 70s, and the research has been revived some 10, 15 years ago, and we know now the ideal, at this time, ideal solution is a 20% calcium chloride solution in 95% ethyl alcohol. And so that has shown, with studies done in Italy and several others too, to be the most effective solution to inject. The acceptance of doing this kind of a procedure is something that needs to be accepted by not only the animal welfare people, by not only the public, but also by the veterinary community. And the veterinarians have been very reluctant to do that, only those that the mavericks, I should say, within the profession see the possibility, are exposed to it. And once those that have been exposed to it and started using it, they are converted. They are using it. There's a couple of veterinarians here in the Dominican Republic that have a bottle of it in their pocket, so to speak. And you use it all on a regular basis. One of the problems in the first world is that say, oh, we have a procedure here that costs $1, and that's exactly what it costs, less than that. And it only requires pre-medication or sedation, not full anesthesia. Feel that is a threat to their business. And that is, of course, not what this is for. This is for the animals that are not owned by anybody.
Correct.
That is, and for those people that have no funding, and those animals are not seen by veterinarians anyway. And so that is not what it's for. And you're one more thing. You're 100% right. With the overpopulation and the management problem around the world, there is no way that we can operate ourselves out of that, so to speak. Surgery is not physically, financially, timely possible at all.
I must say there was a point, I forget if it was last year, probably some of you listening might remember, and I was interviewing somebody wonderful from some international welfare organization, could have been Humane Society International, I don't honestly remember, and there were some pictures to accompany this spay-neuter program that had gone on. I believe it was in some part of India, and they were vets, a handful, you could count them on the fingers of one hand, who were taught to do this, and then they were taught how to do the traditional neutering that we see in the first world, as you would say, in a clinic. But the dogs were sort of laying down on a blanket by the side of the road or the field or wherever they were, and they recovered from their general anesthesia for better or worse. And, of course, they were given antibiotics, again, very costly, but still there was the risk of infection. And they didn't have a chance to recuperate properly after a surgical procedure. And that was, I don't know, a couple of dozen dogs. Recently, I got on social media a very touching young woman in a part of India who looks after the street dogs in Ahmedabad. I don't know where she was. I forget. But I look at it and I think, well, isn't she wonderful? She has 20 street dogs that she looks after, this lovely young lady. There are 250,000 street dogs in the continent, the country of India. 250,000. Now, you know this, but we have to somehow light a fire under the people who are in a position to capture these dogs, because in India you are permitted to trap, neuter, release, but you're not allowed to kill dogs, euthanize them, even for their own welfare. They can hobble around on broken legs, dripping eyes with infection. You can spay, neuter, release, but it involves a surgical procedure. What if you were to address just the country of India? I understand that South America has in Mexico tons of street dogs, but could you get the governments of these countries involved, or is that hopeless?
See, the initial research by Dr. Jana and his associates was done in India and in Pakistan, and they have been exposed to it, and they are using, and they are setting up programs. But in order to get this to the level that it needs to be done, governments have to be involved and see that this is a way to go about it. And of course, they immediately go back to the veterinary community and ask for the veterinary community's advice. And they are ignorant about it, to say the least. Let me tell you that as a veterinarian, we are not taught in school, and we still are not taught in school how to inject a testicle. We are taught how to remove them. We are taught how to evaluate them, but not given an injection. And as simple as it is, this injection still will remain, in my opinion, a veterinary procedure because it looks simple. It is simple. However, complications can occur and do occur because of the functionality of calcium chloride, which is a desiccant, meaning it pulls fluid from cells. If it gets outside the capsule of the testicle, you will get a sterile abscess, which is not the end of the world, but it is a sterile abscess that takes time to heal. And from a public relation point of view, when you introduce something new,
right.
that is not necessarily the best way to go about it. But
right.
It does happen from time to time. But so are there complications on surgeries. And nobody talks about that anymore because that has been done for eons now.
Correct.
And but whenever you try and introduce something new, the first thing is resistance and denial and say, oh, no, we can't do that. And, oh, that must be painful. And even veterinarians ask me that, too. And then I explain that it is not if you do it the proper way with a mild sedation, a slow injection, and there are no nerve endings inside the testicles. If you get a pain reaction, it is because it's what we refer to as a visceral pain. It is like getting gas in your intestines. The pressure on the capsule around the testicle will cause the pain, which is where there are pain receptors. So that's why we recommend per testicle 45 to 60 seconds per injection, and the injection is maybe 1.1 or 1 milliliter, total. So that's a slow injection. Those are some of the issues that we're dealing with and that we need to convince veterinarians individually, veterinary organizations, veterinary regulators, that this is an acceptable method to do, and this may be a solution, at least for the males, in the problem around the world.
Well, what really bothers me is that if they're referring to street dogs, community dogs, unowned dogs, which is what we're talking about, they don't give a darn if those dogs are suffering 24 and a half hours a day. These
Exactly.
dogs have horrible lives, and people say, oh, they're used to it. Well, the people have horrible lives, too, that are living in the street alongside them. Somebody has to say the obvious, which is the suffering needs to stop, and the suffering comes from there being too many animals trying to get practically no resources to get liquid and something edible that could sustain life is already a huge challenge for these animals living on the street, because wherever they're living in poverty zones where the people are scratching out an existence as well. So to say that the dog may experience some pressure inside the testicular sac for a bit is kind of absurd, because their interest in the dog's welfare is less than non-existent. These animals are simply seen as part of the landscape, like rocks or cars. I mean, it's amazing when one goes to, I guess it's impolite to call them third world countries, developing nations, whatever you call them, places where there's loads of free roaming loose animals, which we have very little left of in the United States, except for in our pockets of poverty. And then you say, well, how do you make it better? And to make it better by making less of them. The fewer there are, the less there's a problem for resources, whatever those may be. It's frustrating because I think that in America, I don't know if this is true in Canada as much, or in Holland, where you're originally from, where they're so incredibly advanced in their view of animal welfare and comfort that I'm sure you know this. I just happened to have a dear old friend whose dog was in hospice. The dog was really old and not fully suffering, but he couldn't take care of it totally. And there was hospice that existed for dogs like we have it in America for humans. It's disturbing that people from these other countries only see their own pets and owned pets and worry, what they're eating, and are they having separation anxiety. And there's these millions of animals suffering around the world. And you have a solution, and your colleagues have a solution, that the pushback against it is just baffling to me. I mean, we should all give $1. If we all gave $1, then it would pay for every single one of those injections. But then the problem is, how do you get the local community to embrace it and put it into work? Does it have to be a vet? Can it not be a vet tech? Can it not be a well-meaning nurse, like a veterinary nurse kind of person who could be taught?
Yeah. That is up to the individual country what the rules and regulations are. But of course, under supervision of a veterinarian, the trained people like animal health technologists, or, as you refer to nurses, they will be fully qualified to do that also under direct supervision, because they do much more complicated matters than just injecting into testicles as well.
Right.
But one of the other issues with the product is that it's not patentable. You can buy calcium chloride anywhere in the world. You can buy ethyl alcohol anywhere in the world. And by the way, that's the stuff we drink, and even though it's 95% the alcohol, but that's what it has to be in order to be most effective. But still, those are products that are readily available. And so that is also one of the reasons none of the pharmaceutical companies with the pockets to do the proper research, marketing, licensing, and all that kind of stuff are involved, because they can't get a patent on it. And that is the only way that a commercial organization would get involved with this too. So we're looking, and we are looking for people to help us with this. And that is not going to be a return on investment. That is a animal welfare donation, or however you want to put it that way, angel investors or anything like that, because we need to get the push going that is acceptable. Then we deal with each country individually with their rules and regulations, and those that are up against it right away say, well, is it FDA approved? Has nothing to do what happens in Somalia or in South Africa or Afghanistan. No, it is not. But here in North America, we can use a compounding. And a compounding of a drug means that a veterinarian a pharmacist or veterinarian can mix two ingredients and use that for a specific animal in a specific way. And that's how calcium chloride can be used. And so that is why I provide the calcium chloride in a small bottle. It's a 20 ml bottle with 4 grams of the calcium chloride in it. That's the medical grade calcium chloride, sterile. And the veterinarian adds 20 cc's of the ethyl alcohol, 95% to the bottle. Now you have 20 milliliters of a solution, which will do, depending on the size of the testicles of the animals, do 8 to 10 or 12 animals for, with one bottle.
Peter, we've run out of time, and it's good to have this recipe on hand, although most people listening may not be the veterinarian who's taking notes. But it's important to understand that it's easily done once they get the 1, 2, 3 instructions. I think what you're doing is great. I'm going to give a link to the work that you're doing with the podcast of the show so people who are interested can learn more about it. Thank you for all you're doing. I hope you can spread the message and the needles far and wide. It's wonderful work. Thank you so much for being here.
It's been my pleasure, Tracie. Anytime anybody can contact me, and I will gladly assist and advise.
Fantastic. I will give a link to your contact information. Thank you so much. I'll be right back after this quick word. This show is brought